झूठ से बचे रहे, सच कदम भरे, दूसरों के जैसे पहले खुद को जय करे। हमको मन की शक्ति देना, मुश्किलें पड़े तो हम पर इतना कर्म कर, साथ दे तो धर्म का, चले तो धर्म पर, खुद पे हौसला रहे, बदी से ना डरे, दूसरों के जैसे पहले खुद को जय करे। हमको मन की शक्ति देना।
Good morning, all learners. Giving tribute to our master Samuel Hahnemann, who taught us homeopathy with the dare to be wise. Seeking blessing from our Guru, Dr. Prafull Vijayakar sir, who made us this wonderful science and bridging the science with the modern science and made homeopathy made easy, and homeopathy is mathematics. Jai Hahnemann, Jai Homeopathy, Om Vijayakaraaya Namah. So, in yesterday's sessions, we have learned about the organon aphorism number 6. What is to be looked into the case when case come to you, either subjective symptoms from the patients and objective symptoms from the attendants and relatives and the observation of the physician. So, going ahead in this journey, and we have also learned about the significance of the 7 layer of the separations. So, to continue this journey, we are starting with the further aphorisms from Organon of Medicines, 6th edition. Aphorism number 7. So, yesterday we have learned about the 6th aphorism. Now, in continuation of this, as in the disease, now from which no manifest exciting or maintaining cause, causa occasionalis means the maintaining cause, has to be removed. Again, we further elaborate in the later footnotes. So, we will see it. We can perceive nothing but the morbid symptoms. It must be the symptoms alone by which disease demand and point to the remedy suited to relieve it. And moreover, the totality of its symptoms, of these outwardly reflected pictures of the internal essence of the disease, that is, of the affections of the vital force, must be the principle or the sole means whereby disease can make known what remedy it requires. The only thing that can determine the choice of the most appropriate remedy, and thus, in a word, the totality of symptom must be the principle, indeed, the only thing the physician has to take note in every case of the disease and to remove by means of his art, means art of homeopathy, in order that it shall be cured and transformed into health. So this is very important aphorism, that whenever the vital force is deranged internally, it is outwardly reflected in the form of signs and symptoms. And to look into this sign and symptom, we have to make a totality, and this totality guide us for the appropriate selections of the homeopathic remedy. What allopaths do, or what old school do, that was explained by masters in footnote. So we see into footnotes. So in the first footnote, it was written that we have to remove some of the causa occasionalis or the maintaining cause. So what kind of causa occasionalis is there to be look into? So we have, Hahnemann has classified the disease in 3 categories. One is called as indisposition, one is called as acute, and one is called as a chronic disease. So when there is a indisposition because of some maintaining cause, that has to be removed. So the morbid symptom ultimately removed. So this was in the footnote number 3. It is not necessary to say that every intelligent physician would first remove this where it exists. The indisposition thereupon generally ceases spontaneously. See, be a wise physician that you don't need to remove every cause. But when the cause is because of certain maintaining cause and which produce indisposition, so it gradually ceases spontaneously. So what they have to do, they have to remove that cause. Means he will remove from the room a strong smelling flower. If some person having a uh, some mild indisposition symptoms of the sneezing because of the strong swelling fever, that has to be removed, which have tendency to cause syncope or hysterical sufferings. So because of that, extract from the cornea the foreign body that excite inflammations of the eyes. So that is very important. That if the foreign body is stuck into the eyes, remove that, and then body will take care of it. Loosen the over-tight bandage on the wounded limb that threatened to cause mortification and apply a more suitable one. So, if a tight bandage is done and there is a disturbances in the blood circulation that causes the wound do not heal, so you have to remove the tight bandage and apply another one. Lay bare and put a ligature on the wounded artery that produce fainting. Endeavor to promote the expulsion by vomiting of belladonna berries, etc., that may have been swallowed. Extract foreign substance that may have got into orifice of the body. For example, foreign body in the nose, gullet, ear, urethra, rectums, and vagina. So first and foremost, you have to remove by means of mechanical means. And after that, if any symptoms persist, that has to be removed by medicine. For example, the example is extract from the cornea, the foreign body that excite inflammation of our eyes. So there is one remedy which is called as coccus cacti, in which it was written that after the removal of foreign body from the eyes, there is remain abrasions and inflammations in the eye, and that inflammation and abrasion, if persist, then the remedy is advisable. So this is what you have to look into. Crush the vesical calculus, open the imperforated anus of the newborn infants, etc. So this is what the things which Master Hahnemann has advised, that you have to remove this. Okay, and the disease will go on. In footnote number 4, also he has written that the old Kul's physician in all times, not knowing how else to give relief, they don't know, have sought to combat and if possible to suppress by medicine. So this is what we are dealing with, the suppressions. And here and there, so they look into one single symptom, a single symptom from among the number of in disease, a one-sided procedure which under the name of symptomatic treatment. फीवर आया, फीवर का मेडिसिन दिया, बैक्टीरियल इन्फेक्शन है, बैक्टीरियल इन्फेक्शन का मेडिसिन दिया, कुछ भी है उसका एक स्पेसिफिक सिम्टोमेटिक ट्रीटमेंट दे दिया. Has justly excited universal contempt, because by it not only was there nothing gained, but much harm was inflicted. So this is what the Master Hahnemann telling us, that when you are treating a symptoms or when you are treating symptomatically, that may lead to the suppression. The single one of the symptom present is no more the disease itself than a single foot is the man himself. This procedure was so much the more reprehensible that such a single symptom was only treated by antagonistic remedy. Therefore, only in angiopathic and palliative manner, whereby after a slight alleviation, it was subsequently only render all the worse. So this is what Sir has made us to understand, that the single symptoms, they understand that is not the man, that is the part of a disease only. So they have to remove the disease. But if the single foot is there, we have to understand it is a foot of man only, not the other. So this is what we have to take care into consideration. If we remove, so in the initial stage, it is gradually elevating, but subsequently it rendered worse. That means from where it is suppressed and it goes deeper into another layer and it goes further. So this is what mentions in the footnote number 4. Hope you all got these things. So now we are going back to the reading of our theory of separation. We all know the chart of separations from the ectoderm to endoderm to mesoderm and organ of mesoderm, then endocrine system, then changes in neural plate, CNS and nervous system, peripheral nervous system, sympathetic nervous system, and then finally landed into the change in the genetic code which causes syphilitic symptoms. So we go into our reading, further reading of theory of separation. So in theory of separation, up till now we have completed the 5 chapters, and the today's chapter is on the second prescriptions. So in second prescription, what is the meaning of second prescription? Anyone from the group can share in the chat box what is the meaning of second prescription. Comment in chat box. What is the meaning of second prescription? Prescription after first follow-up, the prescription which is given after the first prescription is right. When the first remedy acted, then after that medicine called as second. The first follow-up, okay. To understand the direction of the cure is right or wrong, okay. Then when the action of the first prescription is completed, absolutely. Anything else? When well-selected remedy has worked in any way, then patient came up for follow-up. Yes, it is a prescription done after the first prescription, the first follow-up, ascertaining that the action of medicine produced after the applications. Yes, great. So you all are interacting with the same thing. The meaning is it's a second. So already before second it is the first. And the prescription means the prescribe. And what is we are doing is analysis of the second prescription. That means when we are going to prescribe second time, we have taken a case, we have uh, made a totality. Out of totality, we have chosen a remedy, we have chosen a potency, we have chosen everything. We apply that remedy to the patient. Patient has taken either by oral or external route or anything or a smelling. Then what happened? The body is trying. See, we have stimulated our vital organism with our remedies. And then what happened? The vital organism has to react against our medicines. So that is what we have to analyze when the patient comes in to follow up. So that is what the second prescription analysis, a simple meaning is like this. So why we need this second prescription analysis? You know, because whenever we are treating any patients, we need to understand where we have to go. See, if we don't know about the destiny, we landed in the journey only. Okay, so if we know the destination, then we have a route map, then we have a goal to reach a particular point. So that is the final destinations we reach. So in that also, when we are applying the medicine to the patient, we are prescribing to the patient, then we have to know that patient has to have this symptom has to be removed, this disease has to be removed, and this is going in this direction, this is going in that direction. So sir has made this science very wonderful with the bridging with the modern science of embryology so that we can understand that either we are going in the right directions or either we are going in the wrong directions. Okay, so in our daily practice we encounter a lot of dilemmas. The complaint disappear in one system only to appear in the another. Comprehending or not comprehending the follow-ups properly might be a key in determining success and failures. In the following example, one can see how confusion it is to assess the patient in terms of Haring's law of cure if it is taken in a strict sense of the word and not understood properly. It is important to remember that a real sense of well-being is always an accompaniment of disappearance of the physical symptom in a right order. Okay, that means very important aspect. Sometimes to many patients are very timid in nature and they do not express. So sometimes when you give a medicine, patient says, "Sir, आपकी दवाई से अच्छा तो है मुझे, थोड़ा थोड़ा अच्छा लग रहा है." That is just a feeling. बट जब हम एनकाउंटर करते हैं कि आपको ये दर्द हो रहा था, आपको ये हो रहा था, आपको ये हो रहा था, उसमें कैसा है? तो पेशेंट क्या बोलेगा? सर 5% जितना रिलीफ है, उतना ज़्यादा तो नहीं है। That means it is something that patient is telling you the feelings. It is not the exactly well-being is happening. So when the sense of well-being is there, it is always accompanied by the disappearance of the physical symptoms in right order. What is the right order? The right order is governed by our developmental system from embryogenesis. So we have to understand this. So based on chart of 7 layer of separation, if meeting it ended in between, we will again join in the same login ID and passwords. Okay. Based on the chart of the 7 layer of separations or disease progression, one find it is easy to answer the query which arise in day-to-day practice. For example, whether follow-up is good or bad. So this is what second prescription mean is we have to assess that our follow-up is good or bad. This is very important. So we look into certain examples what sir has proposed. When direction does each one follow? What direction does each one follow? So, for example, a patient is complaining of pain in abdomen due to acidity, is treated homeopathically. The pain in abdomen disappear and the tingling numbness in the hand start. Is it good or bad? How did the disease progress from center to periphery or inside out? Yes, bad. Absolutely. So today's session is a little bit a conversing session. So we are conversing with each other. That is very good aspect of learning. Okay, great. So answer is disease has traveled from abdomen, that means the endodermal organ, to the sixth level of nervous system. It is a bad symptoms. Clear? So this is what you have to judge. The bad complaint shifted to the higher layer. If we don't know about this 7 layer of separation, then we cannot judge. We can understand that the internal disease has been clear and now it came to the periphery with the numbness. So this is what centered to periphery, but still it is a bad. So we have to understand by judging the embryological development and what is more important and what is less important. So another example, the pain in abdomen disappear and ankle joints start paining. Is it good or bad? Whether this is inside out, upside downward, or more important organ stomach to the less important extremity. What is this? Great. This is a bad sign. Absolutely bad sign. How come? Anyone can explain? Endoderm to mesoderm. Yes, absolutely. Absolutely. Yes, doctor. There is a order of Herring's law corollary also. We will share with you. Great, great. The disease is shifted from the second to the third layer, ectoderm to the higher level, mesoderm layer. Great. So that is what very important. The answer is disease is shifted from the endoderm second level to the mesoderm connective tissue, and it is the bad sign. See, patient came to us with the complaint of diarrhea, and we prescribed diarrhea stop, and the scaling and keratinocytes of the skin start. Means the patient is developing psoriasis. Good sign or bad sign? Absolutely bad signs. It appear as exteriorization. See, it appear as exteriorization of the disease, which has gone from inside stomach to the outside to the skin. But actually, disease has shifted from endoderm, means the second level of to the mesodermal connective tissue, means dermis. The third level, since psoriasis is expressed on the skin and the epidermis, but it is actually due to the pushing of the keratinocytes by the problem in the dermis. So it is a dermatome origins and it is a deeper in nature. So that is what we have to understand. The second point, diarrhea stops and vitiligo appear on the skin, both from inside to outside. Good sign or bad sign? Same as it is a bad sign. So vitiligo is the leukoderma appear due to destructions of the melanocytes which produce melanin. Melanocytes belong to the fifth layer apoptotic system. So again, not only the disease has gone deeper, but there is also destruction which should not occur when on holistic treatment. So again, you have to look into consider. We have considered something that the directions from the layer to layer, but we have to also consider that the miasmatic shift of the patient. Say for example, in the first layer, the patient having a common cold. Okay, second layer, common cold and rhinitis and we prescribe that remedy and the patient develop a nasal polyps. Again, nasal polyp also causes the chronic rhinitis. So do we have a good follow-up or bad follow-up? The layer remain the same, but the shifting of miasm from psora to psychosis. So again, it is a bad follow-up. And again, nasal polyp of the patient has been removed. And now patient develop a atrophic rhinitis and sometimes the bleeding from the nares. It is a good sign or bad sign? Absolutely bad sign. Because still the disease remain in the same layer, but it is again shifted from the psychosis to the syphilis. So we have to look into considerations the reversal of miasm also into second prescription. So this is what our analysis in the second prescription. Third, diarrhea stops and hair fall starts. Again, it is inside out. Good sign or bad sign? Bad sign. Absolutely. So hair follicles, we have learned this thing. Hair follicles, which we find their origin in the dermis, again in the third level. So hair fall which appears so begin. benign and unimportant and is so casually dismissed as B complex deficiency may be indications of the wrong medicine. So many a time you find out that the patient came with the complaint of the fever, and that fever was diagnosed as a typhoid fever, and after that the patient was given a dose of 7 or 14 days of antibiotic, and after 1 month patient came to you with the complaint that now her typhoid was okay, but my hair fall has been started. So again, it is a shifting of disease from the second endodermal layer to the third layer. Okay. Fourth point, diarrhea stops and itching eruption starts inside out. Good sign or bad sign? Good sign. So it is something that epidermis or ectodermal being expressed as out exteriorizations and endodermis clearing. So this is what a welcome sign. The ectoderm being affected after endoderm is clear. So this is very important. Great. So you all are assessing this with the very important aspect that whenever the patient comes to you with the complaint, so you have to assess that area stops and abscess start appearing on the skin inside out. Again, the answer is bad. No pus or infection inviting septic conditions is welcome even if it is an epidermis or ectoderm. It indicates that the immunity of the persons as a whole has not been geared up. Okay, very important. The fourth question, the respiratory problems like asthma disappear. You know, asthma disappear and the patient start dry cough. Is it down upward? Good sign or bad sign? Good, great. So respiratory problem like asthma disappear and the dry cough start, the direction taken by the disease, and if dry cough start, the direction taken by disease is inside out. Hence, it is very good. Again, respiratory symptoms like asthma disappear and sneezing starts. Again, it is down upward. It is a good sign or bad sign? Good sign. Great. Yes, one question was asked that what is the miasm of abscess? Tell me you have learned from this basic understanding. What is the miasm of abscess? What happened actually in the abscess? Pathophysiology. Anyone from the group can share their view also in chat box. Absolutely, miasm is psychosis, but how? Explain. Yes, you all know the miasm. Psychosyphilitic accumulation which may lead to the sepsis. Yes. If it is not in control, if it is in control, then it is something else. If it is out of control, then it is going toward the sepsis and leading to the destruction. Absolutely. So pus collection is a process of accumulations, and that accumulations is because of chronic inflammations. So what happen in acute inflammation? There is a redness, okay, and neutrophilic infiltration happen. But when there is a pus formation, what happen in the pathophysiology? There is a lymphocyte has to act on that, and that lymphocyte accumulate and form a large lymphocyte, making the wound or the foreign substance and phagocyte them. So this phagocytosis and debris leading to formation of the pus, and this pus has to have a vent. And if this vent is not open, then it can go deeper into systemic circulation, leading to the sepsis, and it may damage to the deeper organ. So this is what very important. It can be a psychosis, it can be a syphilitic. If it is not in control, then it goes into syphilis. So this is the accumulation. Hope you all got your answers, Dr. Kushbu. Yes. Again, the same question, the respiratory problems like asthma disappear and sneezing start. Is it down, upward? So it is a good sign, absolutely a good sign. The third point, asthma relief and asthmatic seizing stop, and yet breathlessness on exertion persists. It is a good sign or bad sign. See, patient has asthma has been reduced, sneezing also stopped, but patient says I have to go to the upstairs and there is some exertions. So how come this happens? Absolutely, it is a bad sign. So breathlessness and exertion is short sign that the disease has been suppressed to the cardiac plane at the mesodermal origins. Okay, so great. Fine. The fourth point, asthma has been reduced, but blood pressure increases. Good sign or bad sign? Absolutely bad sign. Great, great. The bad result, the reason is same as above. So it travels from the endodermal origin to the mesodermal origin. Absolutely. Asthma has been reduced and cervical spondylitis starts. Good sign or bad sign? Bad sign. The cervical spondylitis indicates the inflammations of the cartilage of the spine, which is third layer, hence the prognosis is bad. So we have to assess the second follow-up based on our understanding of the embryology, one, our understanding of the chart of suppression, second, and our understanding of the miasmatic shift. These three things keep into mind. Okay, asthma has been reduced and the patient start giddiness. Good sign or bad sign? Again, it is a bad sign. Great. So layer shifted from the second to the sixth layer. The question 5. Lumbosacral pain and sciatica is better, you know, and the huh, this was not question 5, but asthma relieved and lumbosacral pain and sciatica happens. Again, this is what something this. Okay, sorry. This was written like that. The fifth question, the lumbosacral pain and sciatica is better, and pain in chest radiant to left arm occurs. Good sign or bad sign? Absolutely, it was written that it is a bad sign because the disease progression from the third layer, mesoderm connective tissue, to the deeper chest pain radiating to left arm. It is mostly because of angina. Okay, so blood vessels of the heart is affected, and that is leading to the separation. So from third layer to the fourth layer, it is a bad sign. When lumbosacral pain and sciatica is better and blood pressure is increasing, the answer is same like above, from third to fourth. Lumbosacral pain and sciatica disappear. Blood sugar appear to have increased. Good sign or bad sign? Bad sign. So disease progress from the third layer to the fifth layer. See, you all know the things, bad or good, but you have to be reason behind that why it is bad and why it is good. So this is what Sir has proposed this theory to understand the follow-up and the second prescription, that you are going in a right direction or wrong direction. Great. It is from third to fifth. Absolutely. Lumbosacral and sciatica pain reduce and pain in neck start. Good sign or bad sign? Say for example, uh, lumbar spondylosis has been relieved and cervical spondylosis has been started. Yes. So in that, when there is a layer of same layer affected, but in the same layer, the direction has to have followed the corollary of above downward. You know, so that is a very important aspect of understanding. So it is a bad sign. Absolutely. So disease ascent. Now, lumbosacral pain and sciatica has reduced, but facial and trigeminal neuralgia occurs. Good sign or bad sign? Again, bad sign. The neuralgia is of the sixth layer, so from third to sixth layer. Lumbosacral pain is reduced and leukoderma appears. Good sign or bad sign? Bad sign. Fine. Great. So it is again from the third layer to the fifth layer. Again, it is expressed on the skin. Expressed on the skin, but the layer shift from the third layer to the APOD system. So you have to understand this is not the exteriorization. This is something that the miasm shifting from the just pain to the destructive pathology. So leukoderma is a syphilitic in nature, destructive. So you have to look into considerations. Okay. Lumbosacral pain has reduced and lichen planus occurs. Good sign or bad sign? And another question is lumbosacral pain is reduced, headache and dizziness occurs. All are bad sign because lichen planus is psychosomatic in nature. In the nowadays learning lichen planus is the autoimmune in nature. So this is what from psoriatic inflammation goes into autoimmune inflammation leading to thickening and hardening. So this is what we have to understand the shifting of miasm. Lumbosacral pain has reduced and urticaria occurs. Good sign or bad sign? Again, it is reflected on the skin. Great. So urticaria is not only reflected on the skin, but it is a disease of the blood vessels, and there is a destruction of the mast cell causes inflammation in the deeper layer. So this is what you have to understand that there is a secretions of the histamine from the mast cell. So angioblastic origin is the blood vessels origins. Very important. So hence the disease has progressed from the third to fourth layer. Very important. Now, the question 6. The mental symptoms better, but patient feels physically weak. Good sign or bad sign? पेशेंट बोलता है सर आपकी दवाई से मेरे को बहुत अच्छा लग रहा है पर मेरे को खाने का मन नहीं कर रहा है मेरे को काम करने का मन नहीं कर रहा है मेरे को थकान थकान लगता है गुड साइन और बैड साइन सोने का मन करता है तो इट इज बैड साइन ना फीलिंग बेटर इज जस्ट द प्रोसेस ऑफ माइंड बट in the physical body there is the energy and energy having a gradient so we have to understand the energy gradient if the energy gradient is going in a passive way that means in the natural way then our energy is used for our growth but when this energy is shifting from below up that means when the disease has been used our energy then physically we become weak and that is what we have to understand that toxin has traveled from below to up so this is against the nature so it is due to the toxin being transported higher up through the active gradient and this uses up ATP hence the ATP is insufficient for daily work of cells and tissue so this weakness and no desire for work or daily routines is a sure short indications of the suppression irrespective of what mental symptoms is better very important you know why do suppressions occur so practice oriented explanation is suppression is not a monopoly of the physical prescriber or a PQRS prescriber or a formula prescriber even a homeopath who base their prescription on the mind can equally and frequently suppress today the homeopathic world has been unfortunately divided into two extremist camps those who consider the physical only and those who consider the mental only. The, both these camps treat each other as untouchables. They conveniently forget that homeopathy is and holistic science and man as a whole include mind and body. So mind cannot possibly exist without the body nor the body without the mind. It is the lacunae in the approach of homeopaths which have been solely responsible in homeopaths for not being able to see or appreciate the Henning's law of cure come true in each and every cases, be it acute or chronic. A proper prescription to view the law of cure in acute and chronic cases is based on the physical and mental totality, which includes अभी क्या करना है that we have to understand. A proper prescription to view the law of cure in acute and chronic cases is based on both. So, see, in the homeopathic world, there are a lot of way of prescription and lot of way of methodology and treatment modalities available. But what we have to consider when we are treating man as a whole, when we are treating man as a whole, that we need to consider his genetic, his genes. So gene is expressed in a both way. One gene is expressed in the physical form and one gene is expressed in the mental form. So that is what we have to understand. So whenever we want to see the law of cure in each and every case, what we have to consider in the patient. So these are the very important point in our prescriptive totality. So first is in totality, which include the basic nature of mind of the person as is represented in each and every cell by his genetic code. So क्या होता है इस नॉन डिजीज नेचर नेचर मतलब से ही ऐसा है फैमिली में सब लोग ऐसे हैं या उसके अंदर ट्रेट जेनेटिक आया है all participants are requested to mute your mics please. So this trait is called as a genetic trait and which is non-disease in nature. So that means in a very young age, the children become so much so religious because of the family is there in the religiousness. So this is very important non-disease characteristic. Conscientiousness, that means the sense of right and wrong. The temper. So all father was very angry, Dada was very angry, Pardada was very angry. So this child is also very angry. So this is what their temper is like that. This is something you have to understand. This is since childhood. Slowness. सर पहले से ही स्लो है. क्विकनेस बहुत फास्ट है. माइल्ड है. बाशफुल है. So ये जो वर्ड है ना that is related to the dispositions of the particular person. So disposition means what the natural trait which is inherited from the parents. Okay, but it is a non-disease. Bashfulness, contentment, courageous, cowardice, yielding, resignation, affectionate, revolting, or anarchist. There may be a psychotic or syphilitic based on the predominant miasm they came with. Okay, so they have this trait, non-disease trait, and all these have to be considered into the cases. So all these and many other arises from the genetic code inheriting from the parents. That means carry a family trait and thus a tendency to a peculiar. So this was the mental aspect. One thing has to be considered in each and every case. Second, the second is the physical aspect. You have to consider the build, patient's look, peculiar talk, peculiar behavior, both of the individual as well as a whole and his organ and system, and thus have a tendency to particular disease or illness, which together we call as miasmatic trait. So here the behavior of the individual as well as behavior of his organ and system. See, many a time some persons suffer from only one and only thing. See, many a time you came across that the person is having prone to typhoid. So that means the system is weak, typhoid, and our GI system is associated with the emotion called as anger. So we have to understand that some conflict is going on in their family life or in their circumstances that leading to the weakening of this system. So that guide us that it is a miasmatic trait. Even the texture of the hair, distributions of hair, the type of the color of the skin, nail, the length and prominence of the bone, go a long way in considering the right genetic constitutional similum. So this is what the sir has made, that by just observing into this PQRS, sir prescribe medicines. And the third point is the emotions of love, hate, fear, anxiety, fright, illusion, delusion, etc. into consideration. So one is non-disease character, second is the physical, third is the emotions. In emotion, there is an inclusion of the desire and aversions at the physical level, desire and aversion to food, beings, and temperatures. The fourth point, the tolerance and intolerance to various stimuli, either a physical or emotional or a mental. So when we consider all these things, okay, considering only mental or only physical are the chief reason for suppression. This is what sir has guided us. So this has to be considered into the case. Hope you all got this into understanding of this wonderful second prescription. So before prescribing the first prescription, you have to look into this totality, and then you have to prescribe and then assess for the second prescriptions. Great. So we conclude today's chapter 6 here, and yes, uh, please share the order of Helling's law corollary. Now you have to understand what things has to be developed first, and then we have to made it. So first center is a genetic code. Make a imagination and circle over this. The first center is the genetic code. After genetic code, the body is divided into two cells, and then it controlled by the nervous system. So another circle of the nervous system. Then made the nervous system is made, but nervous system has to have the connection with the body part. So they made one thing is one is nervous system and one is a neurochemical system. So endocrine has to be a another layer, the pituitary and hormones. So center is genetic code, another circle is nervous system, another circle is apute system, followed by the organ of mesoderms, followed by the organ of connective tissue, followed by the endoderm, and followed by the ectoderm. So this is what we have to understand one thing. So corollary lies is first, center to periphery, inside out, from most important organ to the least important organ. And the fourth one is above downward. It is what Herring has made that above downward, but we have to understand above downward as a fourth. So this is what you have to understand. The center is very important. So center to periphery, inside out, then above downward. So above downward is the fourth one. And most important to the least important. So CNS is most important and the skin is the least important. So this is what we have to understand, that this corollary. Hope you got your answer, Dr. Khushbu. So great. Any questions? If you have, let me know to my WhatsApp. Uh, so we will share in our groups also. So thank you. It was the time is going very fast. Okay. Thank you all for a daily learning session. Most probably I'm not available on Monday because as I'm traveling from one station to another station, so we will continue on the Tuesday. Okay. Tomorrow we will be there. Most probably we are not on Monday. Okay. Thank you. Thank you for a wonderful session. Thank you, sir, for guiding us. Thank you all. And thank you all. Because of you all people, I am sharing and I am learning from all of you. Thank you. Thank you for being with me in this journey of learning. Yes, Dr. Kiran Lakhani has questions. One of my patient has a trigeminal neuralgia. She was symptom-free for a year. In between, might be given a symptomatic few doses, and the patient has also taken some antibiotic for viral problem without informing me. Okay, then what question to be asked? Then again symptoms appear. Okay, then again symptoms appear. Then what question to be asked after? Suppression might be because of, yes, it can be suppression because of, see, our nervous system is having a power. It has to be express the electromagnetic electrical signal to the periphery. So this is what it is stimulated and it is weak. Okay, so there is a pain. See, there is a signal is passing to the periphery. We don't have any pain. But this is something that the toxin is there in the nervous system, which create a havoc in the nervous system, causing them to the pain. So that has the pain. And the patient was better symptomatically. Okay, after a few doses. And after a patient has taken some antibiotic, and then again the patient having the same symptom. That means still your medicine work partially as you have not strengthened the patients. Okay, either it is because of suppression or either because of anything, it is not important. You have to have the conclusion that you have to stimulate the constitution to the cure towards the cure. So you have to give a right constitutional medicines and which will take care of everything. Okay, hope you got your answers. Thank you so much. We are going ahead of our time. Thank you. Thank you all. So we are ending today. Thank you.